Hello, I'm Dr. Marla Shapiro. I'm a past president of the North American Menopause Society, and today I'm joined by Dr. Cheryl Kingsburg. Cheryl, for the women who are watching us today, tell them who you are.
Well, I am first a woman. Secondly, I am a clinical psychologist, and I have a division of behavioral medicine in an OBGYN department at University Hospital's Cleveland Medical Center. I'm also a professor at Case Western Reserve University School of Medicine. So I am practicing within OBGYN so that all of our practitioners, when they know that somebody has a sexual concern, because I specialize in sexual dysfunction among other things, they can easily ask and refer.
So let's talk about sexual dysfunction, because men easily can talk about this. It's become mainstream, over 24 drugs available for them. But before we even consider the notion of therapeutics in women, most women will not address this. And sometimes they don't address it because their healthcare practitioner is not addressing it, or because there's this mistaken belief that this is part of aging. So first, put into perspective for women the type of sexual issues, dysfunction if you will, that can exist in and around the menopause and well into the menopausal years.
Sure. Well, probably 40 to 45% of all women have a sexual concern. Whether or not it reaches the level of dysfunction, maybe 10% for desire problems, probably 75% if you have problems with pain with sexual activity. There are 4 categories of sexual concerns for women. Problems with desire, what we call hypoactive sexual desire disorder, or the problem with wanting to want. Problems with arousal, the ability of your genitals to feel sexual sensations that you used to. Problems with reaching orgasm, and problems with pain with sexual activity. When you are at midlife, the 2 most significant problems tend to be pain with sexual activity because your genitals lose estrogen and other hormones that allow for healthy tissue, and problems with desire, which really is in the brain, or the wanting to want.
So it's difficult to, get through all the reasons why, but many women have the mistaken belief that this is a natural, I hate to use the word normal, expected event, either loss of desire or pain, that is because of aging.
Well, some of it is about aging, but so what? We do lots of things that reflect changes to us at aging. We color our hair, we go to the gym, we fix things that are natural parts of aging. We don't need to accept it as just learn to live with it. But unfortunately, our society still has that message when it comes to women and sexuality. To your point about the fact that men are comfortable talking about sex, well, thank you to Viagra being available since 1998, all of a sudden physicians or practitioners were able to ask about it because they knew they had a simple treatment. And of course, men want to be sexual. But women absolutely want to stay sexually active well into their 70s or 80s. It's often a matter of finding an available partner for many of them, but they want to stay sexually active. We've done the research, I have the publications, we know that women want that. They don't know how to treat sexual problems when they exist.
Okay, so you can't treat if you don't disclose, and often there's this, women don't say anything because there's a belief there's nothing to be done. And primary care or healthcare practitioners feel, well, if they're not bringing it up, can't be an issue. So for women to stop depending on their healthcare practitioner to have the conversation, how do we empower them to feel comfortable or to have the phrases or the tools to be able to bring up a concern like this?
We want to end this conspiracy of silence. And unfortunately, although I would love to have it end on the practitioner's side, let's not count on them. It is up to women to empower themselves to be able to ask for help, because this is the place. So number 1, I need women to know that it is their healthcare practitioner that is responsible for helping them with their sexual care. Number 2, it is very easy to bring it up, which is to say, I'm having a problem with pain with sexual activity, or I've lost interest in sexual activity and I would like some help. And even if that practitioner looks at you with deer in the headlights, they should know at least how to get you a referral, if not to offer you the treatment themselves. They need to know that it's a problem. We need to wake them up to say, you forgot to ask. And if you bring it up in a way that says, I know you can help me, they're more encouraged to feel like, maybe I can at least find her a referral.
So I think the message here for women is, one, to know that changes do happen in part because of aging, in part because of loss of estrogen. It's multifactorial, but not to stop the conversation from even beginning.
No, you need to ask, because honestly, so many practitioners, when they don't get the training in talking about sex, I'm telling you, they can ask you all kinds of very personal questions about discharge, about bowel function, but they are not trained to talk to you about sexual concerns. They may actually have the answers, they just don't know how to bring it up. Let's help them. Let's get that door open.
So women, you got your marching papers here and your questions in hand. Thank you so much for joining us.
Thank you.